Most people imagine a stroke as a sudden dramatic event, someone collapsing without warning. In reality, many strokes begin quietly and subtly, especially in older adults. The brain often sends small distress signals minutes, hours, or even days before a major stroke occurs. These early signs may include brief weakness in one arm, slight facial drooping, trouble finding words, sudden dizziness, or momentary loss of balance. What makes these symptoms especially dangerous is that they can disappear quickly. After 30 or 60 seconds, everything may seem normal again. Many seniors assume it was just fatigue, stress, or getting older, and they ignore it. Medically, these short episodes are often transient ischemic attacks, TIAs, sometimes called mini-strokes. Despite the name, they are not minor. A TIA is a serious warning that blood flow to the brain has been temporarily blocked, often by a small clot. It is the brain's emergency alarm, signaling that a full stroke could be imminent. Brain cells begin to suffer damage within minutes when oxygen is reduced. The earlier this process is recognized, the greater the chance of preventing permanent injury. Understanding that strokes often start quietly, not dramatically, can save lives. Awareness is the first and most critical step in protecting the brain. When a stroke begins, every second matters. But what many people don't realize is that the first 3 minutes before medical help arrives are often the most critical. These early moments can determine whether a person recovers fully or suffers permanent brain damage. During the initial phase of a stroke, blood flow to part of the brain becomes restricted, but the blockage may not be complete yet. This creates a short window where the brain can still be protected. Simple actions, such as stopping movement, positioning the body correctly, and breathing calmly, can help preserve oxygen delivery to brain tissue until emergency responders arrive. Unfortunately, many seniors waste these precious minutes by trying to shake it off, walking around, or waiting to see if symptoms disappear. Others panic, which increases heart rate and blood pressure, placing even more stress on already vulnerable blood vessels. Both reactions can make the damage worse. Knowing that these first minutes matter gives you power. Preparation turns fear into action and confusion into clarity. If this information is helpful, please subscribe so you don't miss more life-saving health guidance. And comment below with the number 2 if you didn't know the first 3 minutes could make such a difference. Your engagement helps this message reach others who may need it when every second counts. One of the most dangerous aspects of stroke is how easily its early warning signs are dismissed. The brain often sends signals seconds or minutes before a major event, but many people fail to recognize them as serious. Common early warning signs include sudden numbness or weakness on one side of the body, especially in the face, arm, or leg. Speech may become slurred, slow, or difficult to understand. Some people experience sudden confusion, trouble finding simple words, or difficulty following a conversation. Others may notice blurred vision, loss of vision in one or both eyes, sudden dizziness, or an unexplained loss of balance. A severe headache that appears suddenly with no clear cause can also be a warning sign. What makes these symptoms especially dangerous is that they may last only a short time. They can disappear within a minute, giving a false sense of safety. But when symptoms vanish, it does not mean the danger has passed. It means the risk has escalated. These episodes are often transient ischemic attacks, TIAs, which signal that a full stroke may be imminent. Recognizing these signs and taking immediate action can save brain tissue, preserve function, and save lives. When the brain speaks, even briefly, it must be taken seriously. Even when the warning signs of a stroke are clear, many older adults hesitate to take action. This hesitation is often rooted in lifelong habits and beliefs rather than a lack of intelligence or awareness. Many seniors were raised to be strong, independent, and self-reliant. They learned not to complain and not to ask for help unless the situation was truly serious. As a result, when symptoms like slurred speech, facial drooping, or sudden weakness appear briefly, they often convince themselves it will pass. They do not want to make a fuss or worry their family unnecessarily. Another challenge is confusion between normal aging and medical emergencies. Feeling slightly dizzy after standing up too quickly may be harmless, but sudden dizziness while sitting still is not. Forgetting a name is common with age, but suddenly being unable to form clear sentences is a serious warning sign. The difference can be subtle, yet it is life-saving. This delay in action can be deadly. In stroke care, minutes matter. Waiting even a short time can allow more brain cells to die. Understanding that asking for help is not weakness, but wisdom, can make the difference between recovery and permanent disability. When the early signs of a stroke appear, the most important goal is to preserve blood flow to the brain until emergency help arrives. This is where the simple 3-minute circulation technique becomes critical. It does not replace medical treatment, but it can help buy precious time. The moment symptoms such as sudden weakness, slurred speech, facial drooping, or dizziness appear, the first step is to stop moving and get safe. Sit down immediately or lie down to prevent falling. If possible, lie flat on your back and elevate your legs about 12 inches using pillows, a cushion, or a chair. This position allows gravity to help blood flow back toward the heart and up to the brain. Next comes controlled breathing. Breathe in slowly through your nose for 4 seconds. Hold for 2 seconds. Then exhale gently through your mouth for 6 seconds. This breathing pattern increases oxygen in the blood and calms the nervous system, helping stabilize blood pressure. Together, leg elevation and controlled breathing help maintain brain circulation during those critical first minutes. These simple actions can reduce the severity of damage and make a meaningful difference while waiting for emergency responders. During the first moments of a suspected stroke, fear and panic are natural reactions. However, panic can actually make the situation worse. When a person panics, breathing becomes rapid and shallow, blood vessels constrict, and the brain receives even less oxygen, exactly what it does not need during a stroke event. This is why controlled breathing is such a critical part of the 3-minute technique. Slow, rhythmic breathing helps counteract the body's stress response. By breathing in slowly through the nose, holding briefly, and exhaling longer through the mouth, you send a calming signal to the nervous system. This helps lower heart rate, stabilize blood pressure, and improve oxygen delivery to the brain. Calm breathing also helps maintain mental clarity. In a stroke situation, clear thinking can make the difference between getting help quickly or losing valuable time. Staying calm allows a person to call emergency services, alert someone nearby, or clearly communicate symptoms and timing to responders. Most importantly, calm breathing preserves oxygen. Oxygen is the brain's lifeline. Every controlled breath helps protect brain cells from further damage while waiting for professional medical care. In moments of crisis, knowing how to breathe properly gives you something powerful to focus on, and that focus can help protect your brain when it matters most. The 3-minute positioning and breathing technique can be life-saving, but it is important to understand its true purpose. This method is not a cure for stroke, and it does not replace calling emergency services. Its role is to buy time. Precious minutes that can protect brain tissue until professional medical help arrives. Too often, people delay calling for help because symptoms seem mild or because they feel slightly better after lying down and breathing calmly. This is a dangerous mistake. Even if symptoms improve, a blood clot may still be present and a full stroke can follow without warning. Emergency evaluation and treatment are always necessary. Using this technique correctly means doing 2 things at the same time: protecting your brain and getting help as fast as possible. While you lie down, elevate your legs and control your breathing. Someone should be calling emergency services immediately. If you are alone, call as soon as you are able and keep the phone nearby. If this information is new or helpful to you, please subscribe for more clear, practical guidance on senior health and stroke prevention. And comment below with the number 7 if you now understand why acting immediately, without delay, can save a life. Your support helps spread this message to others who may need it when every second counts. One of the most hopeful truths about the human brain is its ability to heal and adapt, even after a stroke. Many people believe that once brain cells are damaged, recovery is impossible. In reality, the brain has a remarkable capacity called neuroplasticity, which allows it to reorganize and create new pathways to regain lost functions. When a stroke damages one area of the brain, other areas can gradually learn to take over some of the lost roles. This is why some patients regain speech, movement, or memory weeks or even months after a stroke. However, the foundation for this recovery is often laid very early, starting in the first minutes and hours after symptoms begin. Preserving blood flow and oxygen during the initial phase of a stroke helps protect surrounding brain tissue, giving the brain more healthy cells to work with during recovery. That is why early actions, such as proper positioning, controlled breathing, and rapid medical care, are so important. Recovery is not automatic. It requires gentle movement, repetition, proper nutrition, and patience. Small, consistent efforts, like guided exercises, breathing routines, and mental focus, send signals to the brain to rebuild connections. The key message is simple but powerful. A stroke does not always mean the end of independence. With early protection and ongoing care, the brain often has more potential to recover than people expect. Stroke prevention does not begin in the emergency room. It begins with daily habits that support healthy blood flow to the brain. As we age, circulation naturally becomes less efficient, but simple routines can make a meaningful difference. One of the most effective habits is gentle morning activation. Instead of jumping out of bed, sit on the edge of the bed for a moment and take a few slow, deep breaths. This helps oxygenate the blood and prevents sudden drops or spikes in blood pressure. Light movements, such as slowly pumping the feet or rotating the shoulders, activate circulation and help blood move upward toward the brain. Hydration is equally important. Drinking a glass of water shortly after waking helps prevent thickened blood and supports smoother circulation throughout the day. Dehydration, even mild, increases the risk of blood clots and reduced cerebral blood flow. Regular movement also matters. Short walks, stretching, and rhythmic exercises keep blood vessels flexible and responsive. Emotional calm plays a role as well. Chronic stress tightens blood vessels, while relaxation, laughter, and social connection help them open. These small, consistent actions create a strong foundation for brain health. Stroke prevention is not about perfection. It is about repetition. Supporting circulation every day helps protect memory, balance, and independence over time. The most powerful message in stroke prevention and survival is this: preparation saves lives. No one wants to imagine themselves or a loved one having a stroke, but being prepared does not mean living in fear. It means living with awareness and confidence. When people know what to look for and what to do, panic is replaced by purposeful action. Instead of freezing, ignoring symptoms, or making dangerous delays, you can respond immediately. Lying down, elevating the legs, controlling your breathing, and calling for emergency help. These simple steps can protect brain tissue and dramatically improve outcomes. Preparedness also brings peace of mind. Families feel safer knowing there is a clear plan. Seniors feel empowered knowing they are not helpless in a crisis. Knowledge becomes a form of protection that travels with you everywhere, requiring no equipment and no medication. Aging does not mean inevitable decline. It means becoming smarter about how the body works and how to support it. Every breath you take, every habit you build, and every bit of awareness you gain strengthens your ability to respond when it matters most. Health is not about avoiding every emergency. It is about knowing exactly what to do if one happens. That readiness can mean the difference between loss and recovery, fear and control, damage and healing. In a medical emergency like a stroke, complex instructions are hard to recall. Fear and confusion can overwhelm even the calmest person. That is why it is so important to remember one simple message that can guide your actions in those critical moments. When blood flow to the brain is threatened, the goal is to protect oxygen delivery and prevent further stress. The message is clear. Do not panic, do not walk it off, and do not ignore the signs. Instead, lie down, elevate your legs, and breathe slowly and deliberately. Let gravity help redirect blood toward your brain, and let calm breathing stabilize your body while help is on the way. This simple sequence is easy to remember and easy to practice. It requires no tools, no special training, and no medical background. Yet it can make a real difference by preserving brain tissue during the most vulnerable minutes. The best time to learn this is not during an emergency. It is now. Mentally rehearsing the steps builds muscle memory so your body knows what to do even when your mind is under stress. In moments of crisis, clarity saves lives. Remembering one calm, simple message can help you respond with confidence and protect what matters most, your brain and your independence. Information only has power when it is remembered and shared. Stroke warning signs and the first actions to take are things everyone should know, not just doctors or nurses. The next life this knowledge saves could be your own, or it could be someone you love. Take a moment to share this message with a family member, a friend, a neighbor, or anyone over the age of 60. Talk about the signs. Practice the steps together. Knowing what to do in advance transforms fear into calm action when seconds matter most. Preparation does not mean expecting the worst. It means being ready. When people are prepared, they act faster, stay calmer, and give the brain a better chance to survive and recover. If this series has helped you understand stroke prevention and response more clearly, please subscribe for more practical, life-saving health guidance designed especially for seniors and their families. And comment below with the number 12 if you believe this information should be known by everyone. Your engagement helps this message reach more people, and that awareness can truly save lives. Stay informed, stay prepared, and remember, knowledge shared is protection multiplied. Thank you for spending your time with this video. Your presence means so much. Wishing you strength, health, and clarity on your wellness journey. Stay inspired, stay informed, and take care.